like you're there. Okay, we're going to get started with our next panel now. I hope you all had a really nice break. I hope you got a chance to meet some new people, talk about things going on, ways that you can be involved, next steps you can take. Please join me in welcoming the next panel on the stage for a discussion on disability policy and practice. California leads the way. I think it's really important that that in California we really take our leadership responsibilities with the rest of the states seriously, and this is a great panel to get us kicked off that way. Thank you so much.
Good morning, all. My name is Jenny McClelland. I'm here with Little Lobbyists. I'm happy to be on this panel today with Eric Harris from Disability Rights California and Aaron Carruthers from the State Council on Developmental Disabilities. You can get your speaker bios in the packet. Clicker. Ha! I'm here today as a mom talking about my son James. My son James is 14. And I'm able to do this advocacy because Medicaid makes it possible for him to access care at home and live the life that he wants to live. My son has a tracheostomy, that's a surgically placed tube in his neck that allows him to breathe, and he uses a ventilator at night. He's also a teenager. He goes to school, he enjoys 3D printing. Last year he was in the school band, that didn't really fit his needs, now he's a theater kid. He is living the life that he wants to live because he has access to care in the community. I got started in advocacy in 2016 in the original fight to save the Affordable Care Act from the prospect of repeal. Much like Nancy, much like Nancy's daughter, my son is a lifetime limit kid. And when I got involved in advocacy, that was the single issue that I understood. Healthcare is complicated. When we entered into this world of raising a child with medically complex disabilities, we entered it in California, where a system mostly existed. And as I got involved in national advocacy, the things that made our life work simply do not exist in other states. So when I work on the national stage with other advocates, it's kind of we talked about Hegelian dialectics in the last presentation. Two things can be true at the same time. Things are better here than they are anywhere else, and we can do a lot of work to improve things here. Both things can be true at the same time, and I think it's really important to hold that in our hearts as we're fighting unprecedented cuts to the Medicaid system. The work I do with Little Lobbyists is families just like mine that engage in active advocacy to say, these are the lives that we are living. And after we got through the first fight to save the Affordable Care Act, I discovered that the fight actually never ends. Olmstead was a 1999 Supreme Court case that provided disabled people with a somewhat conditional right to live in the community. I say somewhat conditional because it's a right that's dependent on budgets and wait lists and paperwork and all kinds of complicated things. I didn't realize until many years into this advocacy that my son was actually institutionalized. My son spent the first year of his life in a pediatric subacute facility 200 miles from our home in rural Fresno County. I didn't know that that's what institutionalization was. I thought that we were just doing the thing. I had heard stories about institutionalization as this thing of the past that we had gotten rid of. It took years in my advocacy journey to figure out that's literally what happened to us. We were following the advice of the people who took care of him. I chose this picture on purpose because the bars of his medical crib kind of blocking him out like the bars of a cage. Institutionalization of kids is still happening today, and medically complex kids like my son are at the highest risk because of the medical definition of fragility. A child with a trach or a ventilator is at huge risk of accidentally dying at home if they don't get 24-hour awake and alert skilled care. Kids like my son are supposed to have a right to nursing care at home. It's supposed to happen. But because the system is complicated and underfunded and really confusing, kids aren't actually getting that care. We were told if we brought him home before he was a year old, that we would not be able to take care of him, that he would die in our home, and that it would be our fault. We weren't given the option to bring him home. We got him out of that facility through a process. It's a little bit memeified. As a description, institutional care is up at the top. That's your gymnastics move where you're essentially just walking across the floor. Getting care at home is a whole lot more complicated. We are asking families to navigate systems that were not built to function, which is a problem because care at home is the most cost-effective and the most effective for children to live the lives that they need to be living. Care in institutions. When my son lived in the subacute, the state of California paid about $500,000 a year, no questions asked. And he qualified for Medi-Cal automatically because he was institutionalized. The process of getting him care at home required me to be the person that I am today. I have been speaking at Family Voices conferences for more than 10 years about this complicated waiver pathway that my son had to take. It's called, right now, the Home and Community-Based Alternative Waiver. California has 3 main waiver programs for children. The first 2 are through the Regional Center for Children with Developmental Disabilities. These 2 programs are hard-coded to never have wait lists. The state wrote a sentence into the waiver program that said when people need this program, they get a slot. The third program for children who are medically complex or who need nursing care is a tangled program, and it causes a whole lot of medically complex kids to fall through the cracks. The cracks are weird and complicated, and I'm not going to deep dive into them at this moment because it's a mess. But suffice it to say, it's the complicated process with the flaming cars and the jumping through the hoops. The Home and Community-Based Alternatives Waiver, its ancestor is from 1988, and it was started with 100 slots. It is a program that has never had sufficient capacity to handle the amount of kids and disabled adults who need care at home. Every year, we end up having to ask for more slots. There was a sweet spot a little bit before COVID that it was an adequately funded program and people were able to enroll in a timely manner. During COVID, we hit the capacity limit and we've just been in waitlist status ever since. The lesson of advocacy that this has taught me is that number 1, I never take no for an answer. This is my soapbox. I live on this soapbox. This one program is the program I care about the most. I also never take yes for an answer. And what I mean by that is that I just keep asking for more capacity. When my son was very young and I started working on this waiver, I want to say capacity was at like 2,000. Hey, we're up to 12,000. If the state gave us 20,000 slots, great, let's keep asking. If the state gave us 50,000 slots, great, let's keep asking. It's one thing to never take no for an answer. I think it's better to never take yes for an answer because we can always ask for more. There's always going to be a yes and factor because the thing that I want, whether it's a budget line item or a program, is I want kids like my son, as he's now a teenager, aging into life as a young adult, he needs to have access to care at home because that's what makes his life the way he wants to be. We have a lot of families here who are perhaps advocating for the first time with kids. This picture on the left, I chose it on purpose because my son was young at that moment. He's in the middle of giving like a ninja kick because he couldn't stand still. When you're advocating with kids, you don't necessarily have to have all the details. Folks like Eric Harris and Aaron Carruthers have a lot of details about these bills and these policies and these waiver programs. The kids are the talent. They are explaining to these legislators in the most effective way, this is the life that these programs are putting together. As a parent, you can become an expert, and I encourage parents to do that. You also don't have to. You can approach your legislators with a problem, and you don't have to have a solution. That's their job to work out the details. You're engaged in effective storytelling if you're keeping it simple, keeping it joyful, and keeping it real. I have two modes of advocacy. I can come at things from a very kind of angry and depressing standpoint and talk about the horrors of institutionalization. I don't want to do that. I want to talk about the joy of community living and the joy that my son is able to attend school because he has a nurse who manages his breathing so he can just do his homework. Because that is the life that we're advocating for. All the programs are just the details. And these kids are involved in the kind of visual storytelling that conveys to the legislators, this is who you are building this for. I'm really excited to be sharing the stage with Eric and Aaron, who will be giving a lot more details on the budget things. Oh, I should have added, AB 2081 is me asking yes and. We gave more slots to the HCBA waiver. It wasn't enough. We need more. There's a secret sentence that the state could write in where they would just say, we're going to fund all the slots we need. And if they would add that sentence, I would leave them alone and stop asking for more slots. So I'm excited to hand over the mic to Eric. Why am I? One more. Why am I so bad at this? Oh. Either way.
I think. It's all good.
All right.
No problem. Hello, everyone. My name is Eric Harris. I'm with Disability Rights California. It's really a pleasure to be here. I want to thank Janice and her team. You guys should know that you have a wonderful director, wonderful leader, not just throughout the state, but just across the board. Janice is wonderful and super helpful to us. So I just want to give her kudos. So some of what I'm going to be telling you all today, and I'm going to try to be as efficient as I can because I know we have a little bit of a time limit here. But a lot of the information that I'll tell you, you already know and have been told some of this throughout the day today and probably, honestly, throughout the last year or so. So quickly about Disability Rights California, if you all might not know, Disability Rights California is one of the 57 protection and advocacy organizations in the country. There's one in every state and territory. So there's one in every state, and then there's one in DC, and then the different territories as well. And Disability Rights California happens to be the largest of all of them. So we have over 300 staff. We have over 100 lawyers, and we do a lot of different types of work. We do work in the community, and we do litigation, just all different types of legal work, policy work, communications work, whatnot. And I have been at DRC now for almost 7 years, and I lead the policy side as well as the communications folks at Disability Rights California. One part of the organization that is important for you all to be aware of is the Office of Clients' Rights Advocacy. They work directly with and for folks who are regional center clients. So whenever you guys get a chance, I just highly recommend that you get to know the Office of Clients' Rights Advocacy. You get to know who some of those advocates are. They work directly with families, with individuals who are clients of regional centers. So that's one kind of important piece when it comes to DRC. A little bit about my background quickly. I've been a disability rights advocate for most of my life, pretty much my entire career from undergrad, law school, and afterwards. And one interesting kind of factoid about it, going from Sacramento, which is where I grew up, to DC, to the Bay Area, I've always felt super passionate about lived experience being a really key and really the most important experience when it comes to advocacy. So as Assemblymember Bonta mentioned earlier, please don't underestimate how important the lived experience piece is. You might not know the detail or the process or the specific dollar amount, but you know what your family's going through. You know what it is to be a parent. You know what it is to be a family member, what your expectations are and should be, and what these elected officials need to know when they're making their votes on important policies that impact all of our lives. So I just highly encourage you all to not underestimate the lived experience pieces and to tell all of your stories when you're communicating with all of these family members. And all of these elected officials. The budget process. I know you all have heard probably plenty about it, but I'll just kind of do a quick recap, high level, of what the budget process is here in California. So every January, the governor comes out with his January budget. So Governor Newsom, in the second week of January, comes out with a January budget, which is basically his anticipated kind of budget for the year for the state of California. So he might say, based on, where we've been the last couple of years, or based on what the federal government is doing, it is likely that we're going to have to spend X amount of dollars on this and have to cut X amount of dollars from other programs. Most years, we have a pretty good idea of what that's going to be. I will say with the current federal administration, it kind of makes things a little bit more complicated. And this year in particular, it was difficult to really have a good understanding and a good grasp of what the January budget was going to look like. As you all have heard, the passing and signing of H.R. 1 really had a major impact on that, because the cuts to Medicaid on the federal level and the kind of trickle effects that it would have on all the states throughout the country is making it so states have to kind of scramble to fill in the gaps as best they can with what healthcare needs are for each state. So because H.R. 1 has been passed and signed, the impact, as we have seen in this January budget, is it's likely that there are going to be certain cuts having to be made at the state level as well. And what DRC as an organization and plenty of other advocates throughout the state are saying, these cuts should not be done and the budget should not be balanced on the backs of disabled folks, disabled families, disabled immigrants, caregivers, et cetera, et cetera. So I highly encourage you all to make sure that that is very clear to all of the legislators, whether you think that they might be champions for you or whether you think they might be adversaries. I highly recommend that you make phone calls, that you set up opportunities to go to their offices. I know that you all are doing a Capitol Day tomorrow, and don't just leave it at going to the Capitol Day. Go and make phone calls, submit letters, reach out to the media in your local communities, and make sure all of them know that these are life and death decisions that the legislature is making and that the governor is making when they say we're going to cut X amount of dollars from these programs, and specifically IHSS funding, in-home support services that families depend on. That cannot be taken away and kind of on a whim or on a coin flip. It has to be set so that families know that they can depend on it going forward. So I think that it is really, really crucial that when you all go to the Capitol tomorrow, you're communicating that to them, because I mentioned the January budget. Right now, we're in the period of budget hearings. So the Assembly and the Senate are having hearings literally this week on these issues, on how many of the programs are going to be cut, how many of the programs are going to be able to be saved. And it's really, really crucial that during this period, they hear as often from you all as they hear from people like myself. Because it's one thing for me to go in and say, I've talked to hundreds of parents or I've talked to hundreds of folks with disabilities, and this is what we all think about, the budget and the direction that it's heading in. But it's another thing when their offices are filled with, 20, 30, 40 parents, and then they get phone calls from their constituents saying how important these programs all are. So for the next month or two, there are going to be a lot of budget hearings. And then in May, there's a revision of the budget. The governor will then say, okay, based on the information that we're getting, based on the revenues that we're getting from taxes, that January budget that I had, I can update it now and revise it a bit based on kind of where we are with the money that's coming in and how much we're going to have to spend. Most years, there isn't like a huge drastic change, but you never know. Last year, for example, with the LA fires, there was a drastic change because in January there wasn't a fire. February, when I think it was February when there were fires. May, there was a completely different calculation of how much we're going to be spending, how much revenue we're going to have. So you never know what can happen between January and May. But in May, there's a revision of the budget, and again, an opportunity for advocates and the legislature to say to the governor, hey, we saw your January budget, we now see your May revision of the budget, and this is what we think about it, and this is what we want you to know. And then from May, another couple of months of hearings and discussions and advocacy, and then the final budget happens at the end of the summer, where there has to be an agreement between the Assembly, the Senate, and the governor, essentially to say, okay, we've heard all the discussion, these are our final calls when it comes to where the budget is. And I just think it's super important to be involved as often as you can through all of those processes, because I was, thinking a little bit about it earlier. We're in, and we say it all the time, unprecedented times. And I know when we say unprecedented so often, it feels like, well, then this is just precedented. It's not, it's not unprecedented anymore. But it is still a critical time. It's a critical time for all of us at the federal level, at the state level, at the local level. And elected officials should know that parents, family members, individuals with disabilities who are impacted by these decisions, that we're going to be vocal about it, that we're going to reach out to our colleagues, we're going to reach out to the media, we're going to put pressure on you. You're not just going to be able to make some of these votes and make some of these cuts and think that you're not going to hear from the local community members and your constituents. So I'll close with this and then hand it over to Aaron, but it's just super, super important that you all are involved. When I first got involved with disability advocacy at Disability Rights California, I was in a position where I was advocating for folks with IDD. I personally do not have IDD. I have physical disabilities. And when I was in the spaces with other advocates advocating for the IDD community, it was weird because I didn't see other people with IDD in those rooms. It was very often providers. It was very often other folks. And I would come back to, my colleagues and then other friends who have IDD, and I'd just say, why is it that in every other space, whether it's, for advocating for the black community, you'll see a room of black folks often. Or if it's advocating for women's rights, you'll often see a room of women who are advocating. But for IDD, it felt like it was accepted to just not have anybody with IDD in the room. And I just felt the need to mention that because I think it's all of our collective responsibility to push back against that and to challenge the decision makers, the elected officials, even as well-meaning as they might be, as well-meaning as providers might be, as other folks might be. It's really important that we push them and say, why don't you have folks with IDD in this room? What have you done to build relationships with folks with lived experience, family members who have direct experience, people of color who have direct experience, immigrants who have direct experience? So I would just encourage you all to think about that as you're doing your advocacy and continue to put pressure on the folks who are in decision-making roles. But thank you all, and I'll go ahead and pass it over to Aaron.
I can't just take the microphone. You need my hands to clap at you, Eric. Hello, Family Voices California. Are there any family voices here? Are there any family voices here? There you are, there you are. As Eric talked about expertise, we have to elevate and value family voices as that expertise. As Jenny said, your lived experience makes you an expert, and I got to tell you how wonderful it is to be with you here again. It's also wonderful being here with my colleagues. When the slides were coming up and I was like, hey, where's Eric's slide? I was sincere. Here's my printed out version of it. You can see my printed has a Disability Rights California slide. You know how I know there was one? Because I made it for him. We are all working together. We're looking out for each other. When I saw the deck and was like, okay, Eric's busy. He's not going to have some slides. Let me just put one together for him. So that when he's speaking, we get to look at his name and his organization, not my name and my organization. But that's part of how we all look out for each other here in Sacramento, as you all look out for each other in your homes too. I'm Aaron Carruthers. I'm the Executive Director of California's State Council on Developmental Disabilities, and sometimes I go into rooms and I just think people know what the State Council on Developmental Disabilities is. I've learned my lesson. I got to back up a little bit and tell you. So the State Council on Developmental Disabilities, and I want to give a hello to my friend and colleague who's in the back of the room, Lisa Hooks, who's at the table. Lisa, you there? Hello? There we go. We were created in federal and state law, and we're funded by, there's Lisa. Hi, Lisa. We are funded by Congress. There's $8 million that we receive, and with that, I am able to employ about 50,000 people, well, I guess including myself and Lisa, and we have 12 locations throughout the state. I am, like Eric, we are part of a national network where we exist in every state and territory. We're funded through what's called the Federal Administration on Community Living. And that Federal Administration on Community Living is within the Federal Health and Human Services Agency, which is led by somebody by the name of Secretary Kennedy, who reports to President Trump. And I am equal parts pleased, maybe shocked, to tell you that President Trump propose money for Disability Rights California, for the State Council on Developmental Disabilities. This Congress agreed to it. They funded it. It wasn't without a fight, and I hope they don't find out all the good things we're doing. So with that, one of the key pieces that we're doing is that we are led by people with intellectual and developmental disabilities and family voices. As Eric said, going into the room, where are the people with intellectual and developmental disabilities? Well, they're at the State Council. They're appointed by the governor, and I say those family members and those self-advocates are the highest ranking appointed governor's appointees in this civil rights movement. I don't know if I'm right. I don't know if anyone believes me, but I believe it to be true for the work that we're doing here. So one of the amazing things about us is that we are an independent state entity. Independent state entity. Those two words don't often go together. But I'm a director of a state department. My email address, Lisa's email address is .ca.gov, but I get to act a whole lot like an advocacy organization, which is a really wonderful thing. We get to work with you and people with developmental disabilities to build your skills, give you the information you need to navigate your world, your life. We also get to find things that are wrong, what's causing a barrier, work with you to go remove those barriers, advocate, change practices, change systems, change laws, and we do that with our team throughout the state. So in the end, we summarize ourselves as being disruptors. Anybody here feel like a disruptor? You know, oh, okay, there's some hands, some excited hands over there, yes. I get really mixed responses when I use that word disruptor. Sometimes I just see it. Like I could see that somebody like, ooh, I get that word. And other people like, wait, hold on right now. Because right now we're seeing a lot of disruption. And some of that disruption from my values are not disrupting for the reasons I hold. There's a lot of disruption just to tear things down. Tear them down. Break them apart. Let's just break them and see what happens. I don't have a plan to fix anything. I don't got anything to put behind it, but let's break it down. We disrupt to make sure that systems are more effective, more agile, more accountable to the people they're there to serve. So if you identify with that term of disruption, believe me, every single day when we're working to get the services we need, make systems work, that is disruption. Okay, so okay, well, this is just a brag slide. Just a slide to brag on our work that we did. Our team of 50 last year, we directly reached out and worked with over almost 106,000 people. 50 people, 106,000 people talk individually face to face. We met with 11,800 people just to talk about your problems. What's on your mind? What do you need? How can we help you? Here's some information. Here's a resource. And 34,000 people came to trainings that we held. Okay, brag piece. Overall, I almost missed the last point. Overall, our work impacted 3 million Californians last year. Okay, so what does the council want? Janice, you invited me to come here and say, okay, what's the council promoting this year? There's two things that are on their mind. Oh, there's a lot of things that are on their minds. But if I could summarize it and capture it, and that's part of my job as executive director, is to say, of everything that's on your mind, what are the two things you want us working on? One of the things they're concerned about is people served by regional centers still need to be served if their family is suddenly separated by immigration, illness, death, any other reasons. What's the backstop in place for that? The second thing that the State Council wants is they want the state of California, its departments, its programs, its services to speak in plain language. Tell us about these services in ways that we know, we understand, we can expect. Tell us in a way that we know that, pretend I'm somebody who doesn't know anything about anything you're talking about. What is this program? What is this service? And how do I get it? Just speak in plain language, please. So with that, we are working to sponsor legislation. The first one is by Senator Elena Gonzalez, Senate Bill SB 1052. And this would allow me, the State Council, it is the executive director at the State Council on Developmental Disabilities, to appoint a contingent or a backup representative for a person who's served by a regional center if the primary caregiver is suddenly not available. So the circumstances we talked about, it's being driven by concerns of family separation from ICE, could also be illness, could be death. This would allow for a free service that already exists in law. You can come to the State Council and say, I'd like this in place in case something happens to me, and then what we do is we issue something that says, okay, if you're not there, here's the contingent plan. You can be I'm authorizing you to be the representative at the regional center. It's already in use, it already exists in law, and it can be used right now for adults who, I'm an adult with developmental disability, I'm served, and I just want some advocacy supports. Maybe my child just turned 18, they still need somebody in the room with them, but I don't think they should be conserved. Is there another option here? Yes, there are other options. The other option is, other times, is there's rights violation cases. Often, Disability Rights California's Office of Clients' Rights Advocates will be out in the community working on tough cases and go, oh, there's somebody here who does not have their best interest at heart. They can see it, they know it Think about it in the medical room, could be in the hospital, and they're thinking, that family member is not looking out for that person's health. They're making decisions to lead them to a bad outcome. They'll call us and say, can you point somebody else? Anyway, it's a really cool tool. It exists. It's free. Let's get it out there and get it to families and others who can use it more. The last policy priority is by Assemblymember Arambula, AB 2360. The law already tells state departments to speak in plain language. Anybody here feeling like the state's doing a pretty good job speaking in plain language? No hands? Okay, not surprised. What this would do is go back in and define what plain language means, start putting some meat on those statutory bones so that state departments are using it more. So those are the highlights I had for you. That's my contact information. You're welcome to contact me, email me, call me anytime. Hey, that phone number actually rings to my cell. It goes to my desk line. In that desk, I haven't picked it up since before the pandemic. So it just forwards over to my cell phone. So give me a call if you need. Thank you.
All right, folks, we have 5 minutes for questions. So after you ask your question, I'll repeat it on the mic, and we'll try to get you the best answer.
Well, we got a couple of Zoom questions, so let me get over to those. All right, from Anna or Anna, I'm not sure. What options are available for advocacy support if a client is not a regional center consumer? Can the Office of Clients' Rights still provide assistance, or where should individuals with disabilities be referred for advocacy services?
This is Eric. I appreciate that question, and I would still start with Disability Rights California and reach out to us. Even if the Office of Clients' Rights Advocacy isn't able to help on a specific case, I would still bring up the issue with DRC, the larger organization, and then we can help to find advocates who can be supportive and involved. And you never know, Office of Clients' Rights still might be able to provide some helpful tools or some kind of point folks in the right direction. So that's what I would certainly recommend. And then there are also a number of other disability rights advocacy groups and folks who not just focus on regional center consumers or folks with IDD, but cross disability as well. So you have Disability Rights Education and Defense Fund, which is based in the Bay Area. They do legal advocacy and policy advocacy as well. And then independent living centers throughout the state can also be helpful, especially if it's because certain issues don't require a lawyer to be involved, and the independent living centers can often point families and individuals in the right direction just if they need some services or if they need help getting services. And there are independent living centers throughout the state in pretty much every major city or even medium-sized city in the state. There's a independent living center, and then there's a statewide kind of group that oversees each individual independent living center, the California Foundation for Independent Living Centers, CFILC. They can also be helpful in terms of advocacy and pointing folks in the right direction.
Right, and our next question from Dina. In addition to reaching out to our own representatives, do you recommend sharing our stories with the Assembly and Senate Budget Committee members?
So this is Eric again, and I would, yes, please. I would honestly, don't limit yourself to any single member or couple of members. I would tell your stories to as many members as you can. Certainly I would start with the folks who are your elected representatives, that makes a lot of sense because they'll know your community. They're you all are their constituents. So I would start with them. Then I would definitely go to the chairs and leaders of the budget subcommittees on both the Assembly side and the Senate side. I would tell them, and then I would just tell your story to as many members who care to listen. A lot of these members have family connections to disability that you might not be aware of. Some of them are parents. Some of them are siblings. You never know who you might touch in that way. So I would just highly recommend telling your stories to as many of the members as you can. But Aaron, I don't know if you want to.
I just want to add for families that as a life hack, you don't have to have a solution. You can go to your representative, ask for a constituent services staff member. Once you explain your problem, it's their job to come up with a solution, and you can tell them, great, we solved it for me, now let's scale it.
Alrighty, thank you all very much. We are going to move on to our next session and panel. Oh, wait. One more question. Okay. We're going to run over there. We're going to talk while we run. It'll be very entertaining. I won't trip, I promise. All right. Glad I didn't miss you. Thank you for my friends pointing me over here. Would you like the mic?
Yes. Thank you very much. My name is Janet Roberts. I'm a parent. I'm a advocate. I am the parent of this child who is a regional senator service client. Thank you for your time. And this is what my question is. I was very impressed with the slide that you had of all of the things that you do, have done. I was looking at the part with the sign language, the activities and impact. So me as a parent who happens to be a provider also, but people may not be providers, I was interested in some of the trainings that you have. Do you have a time frame? How do we find out about that? Do we pay for it? Who pays for that? And how can we get information to be a part of that group for next time?
Janet, this is Aaron from the State Council. We have trainings on 50 to 100 different topics that you'll need. If you talk to my friend Lisa there in the room, she can get you connected. We'll want to know where you are in the state, because we have an office local to you in the state. You asked who's paying for it. Congress, President Trump's paying for it. We don't report to them. We don't say that you came to a training, but it's federally funded. It's free to you. It's available for all. It's a lot of different topics. It's throughout the state. It's sometimes in person, sometimes online. So talk to Lisa and she'll get you connected. Thanks, Janet.
All right. I think we are now good to move on to our next session. So thank you to our friends on stage. We're going to switch on out. And please welcome our presenters for the